Okay, everybody, welcome to our webinar this morning. It's about 10:02, so we're going to get started with our 5 lessons learned from the COVID-19 response. This webinar is designed to share with you some case studies and resources to help you learn about how to use ArcGIS Hub for response and reopening efforts, as well as a plethora of other uses for that technology to help you with your community engagement. Now I'd like to introduce our presenters today. Today we have with us Alfredo Herrera, the GIS analyst at the City of New Haven, Connecticut. We appreciate him spending time with us today to share his experiences and insights learned with using ArcGIS Hub. And my name is Maria Jordan. I'm a product marketer at Esri, and I work with our ArcGIS Hub and open data products, as well as many of our apps that involve community engagement. And this is my colleague Morgan Sapia. She's a solution engineer at Esri, and she will be leading the bulk of this webinar. Now I'd like to go over our agenda for the day. These are the areas that we'll cover during today's webinar. First, we'll go over the 5 lessons learned from the COVID-19 response and what people have learned from using our ArcGIS Hub templates. Then we'll go into a case study about the City of New Haven's work. We'll talk about pre-COVID-19, how we're operating, and then Alfredo will share the during COVID-19 situation. And also, he'll look ahead and share with us what they're planning to do next. Thirdly, we'll go through some getting started resources to help you learn more about how you can do the same kinds of things for your city or organization. And then we'll end with a question and answer session. So please, while we're presenting the first parts of this webinar, feel free to enter any questions you have into the question panel or chat, and we will get to those as soon as we finish the main part of the presentation. So thank you for joining us, and with that, I'll hand this over to my colleague Morgan to get us started.
Thanks, Maria. Hi, everyone. I'm happy you've come to this webinar. You know, times are pretty tough out there, and the world has gone through some intense highs and lows. And given the current global situation, it's imperative that we are all maintaining close relationships within our communities. So, as many of us have come here to learn about citizen engagement within communities in this time of uncertainty, let me quickly introduce myself. My name is Morgan Sapia, and I'm a solution engineer here at Esri on the Smart Cities team. My focus is ensuring that governments have the means to engage with their communities no matter what situation they may be put in. With everything that is going on in our world, public notice and ensuring reliable, truthful information is given to our citizens has been at the forefront of this global battle. Whether it's ensuring people are receiving meals, getting proper treatment, or relaying honest numbers, it needs to be done efficiently and effectively. And you can see all of the headlines at the state and national level. COVID-19 headlines are constantly popping up on our screens. But as time has gone on through this pandemic, I've been curious about what has this world learned? What can we do to prepare for another pandemic? How can we start learning about what to do for the future? And that's what we aim to do today, to go over the 5 lessons learned from the COVID-19 response. And again, you will hear firsthand from GIS analyst Alfredo Herrera from the City of New Haven, Connecticut. First, I want to start off with a quick poll. So, Maria, could you launch the poll, please?
Sure. Here it is. What we're wondering is, when during COVID-19, did your city or town rely on a community communication campaign, or did you rely on your state or county to do that work? So the choices are: we had a community campaign, or we relied on the state or county. Please let us know how things went for you in your city or town.
And yeah, we're really interested to see how, you know, different governments and how different people are handling this communication. So hearing from some of you will be so helpful.
Yep, we're hearing from a bunch right now, Morgan. So let me just give
Good.
it one more second for people to enter their responses. Looks like everybody's had a chance. So I will go ahead and launch that result, close the poll, and launch the result.
Hmm.
There we go. So it looks like about 36%
Wow.
of the folks have had a community campaign, and 64% relied on the state or county.
Wow. Thanks for filling that poll out, everyone. It's so interesting to learn about what different governments relied on during this pandemic. So thank you for doing that, Maria.
Yeah,
Very interesting.
and now I know Morgan and Alfredo have some great things to share about how um, communities can do it on their own and also how they can work with their states and counties. So
Mhm. So I first want to note what many people have gone through during this time of crisis and what we see as a crisis management life cycle. As we continue to move forward throughout this pandemic, we need to also consider prepping for a future crisis. We have laid out different phases during the crisis management life cycle. No matter if you're a business owner, a GIS analyst, or a director of a company, these concepts are universal. And while they may require a different focus depending on what stage you are in, the narrative is still consistent. This is a cycle, so we have learned to always be prepared no matter what stage we may be in or how comfortable we may become. We have seen the first initial response to the crisis helps lay out the rest of the path, but also how you prepare for a crisis can influence how you respond initially. After an initial response, the next step is to figure out how to recover from the crisis and how to continue business. Both crisis response and business continuity are more reactive in nature, but situational awareness, prevention through modified business practices, and prepping for the next crisis are more proactive in nature. If we can all understand the key strategies in the crisis management lifecycle, we can all be better prepared if and when the next crisis happens. I also want to quickly mention that GIS has had and will continue to have a pivotal role in crisis management. Pandemics, GIS provides an integrated system for the COVID-19 response. It's an integrated system and also an iterative system. It supports each phase of the response. And while we may be in a different stage of the pandemic, or maybe we're even reopening, we are still seeing that we have to respond to the crisis and that new information becomes available every day. So these are the major system components. And the first one is understanding community risk. And based on that understanding of community risk, social distancing policies are then put in place. The next is measuring social distancing effectiveness. With these policies in place, we need to ask, are they being effective? Are these policies reducing risk of infecting others? The next and in the middle is modeling the spread of impact. Based on community risk and policies in place, what are the expected impacts on the healthcare system? How many beds will we need, or how many ventilators will we need? And with that, we then move to managing these limited resources, including the optimal allocation of testing and treatment sites, and sharing this information with the public so that they understand risk, what they can do to reduce risk, and where they can go for testing and treatment. These components work in concert as a single system, with the output of each component serving as an input to other components. So now that I went over the crisis management lifecycle and how GIS plays a role in it, I want to dive into the 5 lessons we have learned from the COVID-19 response. The first is to establish a baseline. When the number of people diagnosed with COVID-19 virus began growing around the globe, many were concerned about shortages of beds, supplies, devices, and medical personnel. With that, leaders began creating models that could quantify the surge in COVID-19 so that proper planning could be done to prevent these shortages. With this knowledge in mind, the state of Florida used the basis of, to, identify those in the community that are susceptible, infected, and at risk. and recovered. They have been monitoring the numbers of positive cases, deaths, and those that have recovered throughout the pandemic, so they know the baseline at which they can return to. Knowing where the state started at the early stages of the pandemic will help decision makers analyze how they can return to a normal, or to a new normal, rather. Without this data, there is no way to monitor the community and where we are heading. The process of monitoring symptoms and cases lets the community be more resilient and get back to a new normal. The second lesson learned is connecting and opening the data. So I actually just moved out to California, and I didn't know my town very well. And I expected this data to be open in public. I moved out to California right in the beginning of the pandemic. And I wanted to learn more about what my town was doing in response to COVID-19. And honestly, any information around COVID-19 in my town would be helpful. And I, along with so many others, were curious to know about testing sites near us in medical facilities, or what to do if we even felt sick. So Maryland health officials have shown all the data that they have and any advice that they can give. They have answers to testing sites, resources available, and other helpful information. This data is live and constantly updating when new information becomes available or new COVID cases are reported. Maryland connected the data to provide more context to what the state is doing in response to COVID-19, which allows for more transparent communications between government and community members. The third lesson learned is to update the community regularly. National news outlets do not update local circumstances. Making updates that are hyper-local to your community members is so important to build trust and ensure the community is staying calm. With regular updates, the community can look to you for that authoritative information and data that they care about. Providing a destination to update community members is so important to gain that trust. Again, moving across the country to California from the East Coast, I wanted an easy place to go to so I could have real-time updates about COVID-19 and what my town was doing to recover from it. And there's this idea of a growing community of collaboration and connecting the local data together and bringing these models together in a cohesive way. And it's important so that community members can understand what is happening at the local level. The fourth key lesson learned is quantifying and predicting the surge, which is more proactive in nature. Governments can use some really widely known models that integrate into your current workflows to predict and quantify future surges. Predicting these surges can help government prepare for an influx of sickness. And our goal is to predict, where is that virus going to next? Who will it affect next? And when will our systems, particularly healthcare systems, become overwhelmed? And it's no secret that resources are limited. So Esri has used a model from the University of Pennsylvania called the CHIME model, which is a widely used epidemiological model that brings together the susceptible, infected, and recovered population with other preventative measures, like social distancing policies, to accurately forecast where we need more resources. This combination allows us to make the most accurate predictions, prepare for them, and allocate the appropriate resources like ICU beds and ventilators and PPE. The most important part of this is something I had already mentioned, opening and communicating the data. If we have the right data, we can make the most accurate projections and prepare for future events. The fifth key lesson learned is communicating phased reopening. I will assume that a lot of people on this call want our current situation to end soon, whether it's parents wanting schools to open back up, offices reopening, or being able to go to a grocery store without a face mask. Two-way communication is so important in this reopening. And it's about having feedback from businesses and community members. You can use apps and surveys to collect information directly from businesses for their self-certification or for open hours and precautionary measures. Community members can then use this information and find out exactly what's going on in different businesses and feel safe about going into town or restoring to a new normal way of life. And on the other hand, if a community member goes into a store or a business and notices it's not following proper safety measures, they too can submit on it. Communicating what stores are open and telling constituents why they are opening will ensure trust and open two-way communication between all stakeholders like government, business owners, and citizens. So next I will have Alfredo Herrera from the city of New Haven talk about the city, where they started, where they are, and where they're going.
Thanks, Morgan. I'm Alfredo Herrera. I'm the GIS analyst for the city of New Haven in Connecticut. I've been for the city for about 3.5 years now, and I'm kind of the go-to person for GIS in the city. I'm really the only GIS person for the city. So where we were before the pandemic really kind of, and the lockdown really kind of took hold was we were pretty well underway in turning the GIS system from a simple system of record for, like the assessor's office and basic mapping needs to kind of trying to make it more of the central hub for kind of all the different business systems. So things like the assessor's office, naturally permitting, health department, housing inspectors, DPW, and then also integrating uh, and using it as a reporting tool so that the leadership can make decisions. So like taking information from our 311 system and overlaying it with city assets and city responses and calls for service and things like that. The GIS has been kind of the natural fit for all of that. But as you can imagine, kind of breaking down those silos and kind of moving in that direction is a long and arduous process. So as the pandemic started looming and we kind of I kind of got ahead of it and started kind of gathering what tools I had and at my disposal within the GIS to kind of bridge that gap. The administration then, as I was doing that, made a request like, look, we need to kind of a way to better communicate this stuff. We're kind of doing it very ad hoc. They were doing just text-based updates on the city website, and so I kind of asked for a meeting with the mayor so that we could present a proposal to kind of use ArcGIS Hub as the central repository and the central place to kind of disseminate all of that information through. So we met with the mayor on, I think it was like a Wednesday or Thursday, and we kind of went through the process. We explained what ArcGIS Hub is, what it could do, showed a few examples. At the time, there were not very many COVID sites. This was before the template had come out. So we kind of laid it all out, and interestingly enough, because the mayor is very new and he hadn't seen a lot of what the work I had done up until that point, he asked the kind of the pertinent question is like, okay, my understanding of GIS is maps and mapping in that kind of space, and this seems very much like a web exercise. Why is GIS the solution here? So my answer to him was that, look, GIS provides a bridge for visualizing all of this data that the city collects on a daily basis and allows us a platform for providing transparency. So as such, a very strong component of that is to use the web and websites to kind of promote that information. So he kind of took that into consideration, and so on Saturday morning he emailed me and said, yes, go ahead, build the site. So I work closely with Esri Professional Services, and by Monday morning, or Monday afternoon, I should say, we actually had a draft of the site pretty much ready to go. A little bit of back and forth with both the mayor and the communications director, and we had the site live on Tuesday afternoon. So once the site was live, we kind of started this campaign of, okay, let's build a communications team around it so that we can make sure that the data stays up to date. One of the key things that we did was make sure that we had a local count of the COVID confirmed cases. By default, the template also includes the number of deaths, but we felt at the time that because we were so small, it would be a violation of privacy to kind of share that number, and we've kind of, kept with that going forward, just because even though we felt it was a relevant number to know and share, we did not want to kind of promote it as something that as a focus of our efforts in communication, because we felt it sent the wrong message. So as we were building out the site, we made sure that the site could be translated. At the time, the Google Translate functionality was not yet built into ArcGIS Hub. So what we did is we took a lot of guidance documents and manually translated them into Spanish. As a native Spanish speaker, I helped translate some of those and make sure that the spelling was right on the context menus. And then we had a Arabic translator translate all of the Arabic, as you can kind of see there in the middle of the screen. Obviously, I couldn't check the accuracy of that as easily as I could Spanish, but a little bit of back and forth, and we got it all dialed in. And I was very, very happy that even non-Latin text could be rendered easily on a hub site. So that was really, really kind of good for us. The other thing that we did, because like I said, the auto translate tool for the site was not yet ready, we did two things. One, I contacted my Esri solution engineer and my rep and made sure that we sent it up, added our voice to the request to the hub dev team that, look, this is something we need. It is important to us. Can you please make it a high priority? And to their credit, they took that under advisement and it got hyper fast tracked and it was up within weeks. The other thing that we did is we added a link up at the top of the page, which is no longer there because we can translate the page natively, was to provide guidance documents on how to use the native translation function on each browser, whether that was Firefox, Chrome, iOS, or Android. To use the built-in translation function in the browsers to translate a page for those that needed it. Thankfully, it became much easier to do, but at the very least, we had the ability to do it, and Esri was responsive enough to kind of provide a fast track that functionality for us. The other thing, so from there, we made sure that we had a custom URL. As you can see right there up at the top of the browser window that Morgan is showing, it says covid19.newhavenct.gov. We wanted to make sure we have a very simple URL and we could repeat it and share it widely. So as we kind of built out the communications team and started working with all of our different internal partners, we started meeting daily at the beginning of the lockdown and making sure that all of their information was being up to date. I mean, at the beginning, we were getting major structural site changes, like take this dashboard, put it on its own page, make sure we add FAQs, things like that. And then as the whole process became a little bit more stable and started kind of settling down, we moved to like 3 days a week for a long time. And now we're down to like 2 days a week, just because there are so many fewer changes that are needed to be that need to be made, and new news that needs to be communicated. So from there, I want to kind of talk about some of the organizations that have been part of this process, or when I say organizations, I really mean like departments within the city initially, even though we do have some external partners that have been helping us tremendously. So first and foremost, as you can see from this diagram, the GIS is kind of at the heart. It has a kind of a dual role here. Part of it is the GIS through Hub is the public face, it's the website, but it also is the interconnect between all the various different business systems so that we can kind of look at all of the information and make decisions in context with each other. So we don't want to necessarily look at the number of cases completely divorced from where people are requesting services or through our 311 system or calling the nurse hotline, and we use the GIS to kind of overlay all of those, whereas normally they live, eat, and breathe in separate business systems that would otherwise not talk to each other. So first and foremost is the mayor's office, the communications director, the CAO's office, the health department, and economic development. That kind of whole side of that is kind of the core team that made the decisions as to what the message is, what are we sharing, how are we sharing it, what are we saying, what are we not saying. Obviously, the communications director would take the lead of the health department and the health director to kind of understand, okay, what makes sense to share, what should we be saying, how should we be keeping people safe, and they would work in conjunction with the CAO and the mayor to ensure that the message was on target. Economic development would coordinate very closely with our business community. And then we get into kind of like the more kind of internal side. So information technology, that's where the GIS lives, and the web admin for the city's main site, and then as well as public works. So they provided the actual work. So when people make their requests, they're the ones that have to respond. They're the ones that have to provide the service for the citizens. So keeping in touch with them to make sure we knew what was possible, what was not possible, what the response time is, how should we respond in certain cases to people's concerns was very important. And then finally, the community services administration. They were very instrumental in working with the broader community. If you could hit next, please, Morgan. So through the faith community to make sure that the pastors knew what the rules were for congregating, whether they could congregate, and if so, how. And then the food policy director and the administrator, she would work with the food pantries and soup kitchens and the schools to make sure that people had access to food whereas normally they might not. As you may or may not know, New Haven is a very economically diverse city, so we wanted to make sure that our services were available to everyone, whether we were operating as normal or not. Another couple of really important things that we did was we also made sure that our housing inspectors and quality of life neighborhood coordinators were in the process and would provide feedback and kind of that kind of boots on the ground ear to the community as to what was going on, what were the concerns. Human resources would chime in and say, okay, well, this is what we need to work on as a city. This is what we can do. These are the restrictions of what we can provide to make sure that we can keep people safe and our workforce happy and healthy. And then we also had a social media team that would help and do media campaigns with billboards, Facebook, Instagram, what have you. So the communications director and the social media team worked very closely together. So as we shared this stuff, it became very common and important for us to make sure that every time we had a press conference, every time we sent a communications out to the press, whether it was print, web, or TV or radio, that the URL for the site was always in it. if you want more information, go to our site. That was kind of our crux of everything. And because of that, we made sure it was important that as we started adding content and we started kind of branching out into letting certain members of this kind of web do their own thing, because they could do it. One, they know their subject matter much more deeply than I do and can build it much more effectively. It kind of takes some of the load off so that we can basically get more done in a short amount of time. So if you want to go to the next slide, we can show the food policy page. So basically built up created a template page for the food policy director, gave her a quick 10-15 minute rundown of how all the elements worked, and to her credit, she just went to work and got it done. Started making maps, story maps, links to other websites, went and scoured the webs for clip art to include to make it more visually appealing, so the website didn't end up being just like a wall of text. As things progressed and she started making kind of good headway into creating the food resources page, we wanted to make sure that other parts of the pages were doing the same kinds of things. So we put up web apps for testing sites. We put in we used a story map to kind of communicate and link people to the links for how to sign up to be a medical volunteer in the Medical Reserve Corps. And so using the hub in these kinds of ways was really, really effective for us in kind of making sure that we could get the message out effectively and quickly and very broadly. So to that point, we started thinking, okay, well, like I said before, our city is very economically diverse, and what are there any areas that we need to really worry about and kind of use alternative means to kind of contact? So we started looking at demographic and market research data from the Esri Business Analyst platform to see what the internet usage was like over broadband from a computer. So this chloropleth here is kind of what that is, and it goes from lightest color to darkest color, depicting the access to the internet. So the kind of like those white areas are in the kind of 40% range for access to the internet. So we were a little worried that, okay, how are we going to reach these communities, because they're the ones that need our services the most. So we kind of kept digging into the data, and we started looking at the cell phone data, and we realized that even in those areas where we had 40% usage of the internet from a computer, the usage of the internet from a cell phone was still well over 66%. So one of the first things we did is, okay, let's go review the site and take a look and make sure that it is mobile friendly. We made a few tweaks, made sure that everything looked good, and then kept that in mind going forward as we added and removed content to make sure that it didn't look absolutely terrible or completely illegible when we would put it on a mobile device. Case in point was we made sure that the now famous Johns Hopkins dashboard had the alternative link to the mobile site enabled as an alternative within the within Hub, which you can add. UConn, University of Connecticut, actually created a state level version of that dashboard, and they did some neat things with Experience Builder that made it so that it's auto detect. So we just had to coordinate with them and add that URL, that updated URL, so that whether you were on a desktop or a mobile device, it would say, oh, I know which version to show you. So from there, we were able to kind of coordinate with all the different advocates within the community through this Community Services Administration and through our Livable Cities Initiative, which is the quality of life group within the city, to make sure that, okay, yes, we're covering about 2/3 of these neighborhoods with our message from the website. Let's make sure that those people that provide services to that last third know where to look, so that when they get questions from that underserved community, they know where to look up the information and provide it, so that this is still a resources for those providing resources. So from there, we kind of started looking at the analytics that are built into the hub site and say, okay, well, how broad has our reach been? So to date, we've had about 500,000 total views since we first put up this site in March. To us, that's a big win. One of the interesting things that I will point out with that is that every time we made a major press release or a TV news story about the pandemic, and we made sure that we included the URL in the broadcast of the article, we had a spike in views. So that to us was kind of indicative of people were going to it. You know, they were seeing the URL, they were visiting the site, they were looking at the information that we were providing. The good thing about that, really kind of what that meant to us, other than just like, hey, cool, what we're doing is getting seen, was, okay, because this is being seen, we now have a responsibility to make sure it stays up to date, it doesn't go stale, and people stop saying, okay, yeah, it's cool, but it hasn't changed in 2 weeks, so I'm not going to bother ever looking at it again. So to that point, we still have, in the last 30 days, 12,000 unique views. And if you look at the total number of views of people refreshing the page, it's, you know, upwards of like 25,000. Even in the last week, we still have 2,500 people looking at this. And that's unique people looking at this. So even in this latest stage of the game, people are still using this site as a resource, even as we reshape the site. You know, the site that we have now up is very different than the way the site looked before. Before, the site was, you know, a lot of information on the home page, just scroll down to see more and more and more. And the way we have it set up now is because we have more initiatives, sub-initiatives within the site, like Reopen and the stuff for the business community, the stuff for food policy, other local and national resources. We kind of broke all of that up so that, okay, the absolute pertinent information is on the homepage, and then people that want to see the other pieces of information kind of drill down and kind of look through it there. So as we talk about, you know, getting the broad reach out, the other thing that we were very careful to keep in mind was privacy. We wanted to be transparent, but we also didn't want to violate people's privacy, or, you know, in some cases, you know, their HIPAA protocols, because this is people's lives, this is people's health and well-being. So we worked very closely with the health director, with the communications director, and all of those people that had access to the granular level data to ensure, okay, what do we want to show? What do we not want to show? And why do we or do we not want to show it? So that when someone asks, well, why aren't you showing this? We have a kind of unified responses. We are not showing this information because of this reason. For example, the deaths. We did not want to show the deaths on the page because at the beginning we had maybe 1-2 deaths. In a city of 21 square miles, even with 139,000 people, 1 or 2 people is a little bit too identifiable. You know, obviously now that number is much higher, but while it's still a small enough community that we did not want to kind of share that. I mean, we do not share even the numbers by neighborhood because, for example, we have a neighborhood that only has 106 people in it. Any cases in there, and it's going to be too obvious who that person is. So, you know, every step of the game, we were very careful to talk with the community services administrator, to the health director, to the communications director, to the mayor himself, to make sure, okay, what should we be saying? What should we be not saying? What is important for people to know, but what is not, what is more harmful than good? So that was very much something that was on the forefront of our minds as we kind of got through this. And the number of tools that we have internally versus forward facing are much higher. We have, numerous dashboards that we look at internally based on, like contact tracing stuff versus the number of cases, the number of deaths, their race and ethnicity and things like that. But that is for us so that we can do our jobs. And a lot of that is not necessarily being shared for the simple fact that we are just too small to share it and still maintain the level of privacy that we want to maintain. So kind of going off of that, what did we learn? So one of the biggest thing, at least for me, was that we reinforced our trajectory that we had before the pandemic, that the GIS was going to be kind of the central hub, sorry for the pun, for all of the business systems to kind of coexist and kind of, to quote a little bit of jargon, to kind of break down the silos within City Hall and get the departments kind of working together a little bit more collaboratively, which this has absolutely done. Case in point is the ability to enable departments to create their own sites. I spoke in depth about how the food policy director, with a few minutes of training, was able to build her own site. But what I didn't mention is that the City Plan Commission and the Board of Zoning Appeals also built their own sites because they were instructed to go virtual. They had the tools to kind of go virtual, but they didn't have until I showed them how to set up the hub site, they didn't have the tools to kind of share with the community, solicit feedback, and do all of that pre and post work to the commission meeting. So for them, Hub has enabled them to set up the planning commission meetings and have all of the pre-meeting exercises done, and then move on to the meeting itself, and then do all of the feedback and post meeting activities. The same with the Board of Zoning Appeals. And kind of on the back of that, we started kind of branching out into other departments. For example, the food policy director wants to take her sub-page from the COVID site and actually make a whole hub initiative page around it so that she can kind of continue to communicate her stuff outside of the parameters of the COVID pandemic. The other thing that we learned was repetition was key. We made sure that we included the URL in every communication, in every press conference, and every Zoom meeting that was publicly available so that people knew where to go. And as I mentioned in the numbers, it showed. Every time we made a press conference, the numbers spiked. So that was a very effective thing, in conjunction with the fact that we made it a point to make the URL sayable, and also, more to the point, translatable, because trying to convey the idea of a hyphen or a underscore in another language, like even Spanish, is a little tricky and can cause a lot of confusion. So we wanted to make the URL as easy to say as possible, and just say, look, just go to covid19.newhavenct.gov. That's something that when you're on the phone, even anybody can remember. Just, oh, okay, yeah, covid19.newhavenct.gov, and they go and they find all of the information that they need. So going forward, we're looking to kind of use Hub in a much more broad way. We are using all of the GIS as at our disposal. We're using web apps more, we're using surveys more in every department, whether it's economic development, the health department, engineering, traffic and parking, permitting, livable cities initiative, and economic development. They're really ramping up with using surveys. City Plan Commission, not only are they using those hub sites, they're also working on setting up ArcGIS Urban and getting that whole thing set up with an eye to make sure that it works with our hub sites so that we can communicate what's going on in our community from a development standpoint more effectively. We've opened a hub page for reopening, and that was really easy to do. The communications director and the mayor said, hey, we need a page for this, and within a day or two we had it up and running. And then the other thing, so the last couple of things I'm going to say is one of the big things that really helped out is all of our vendors throughout this whole pandemic really stepped up to the plate, from Esri at the beginning and throughout, in helping us get the hub site up in literally 3 days, to to our 311 vendor and our CRM vendor really kind of collaborating and talking to us in a way that they never had before, to make sure that instead of it being, okay, yeah, we're helping you, or here's your stuff, to, okay, how can we help? How can we help you use our tools more effectively to make sure that everybody in the community stays safe? And I guess kind of the last thing is, I'll leave you with this, is we went from the mayor saying, well, how is GIS relevant to all of this web communication, to him understanding that idea and wanting to expand it to everything from economic development to city plan to police to permitting, everything, and saying, okay, yes, we need to use this platform much more extensively because it is agile enough to do what we want to do, and it will help us not only get through this pandemic, but become a more transparent and effective communicator to our community going forward.
Great. Thank you so much, Alfredo. What you said can really resonate with so many people, and it's so interesting to learn about your outreach and New Haven's response. So if anyone on this call has any questions for Alfredo and I, please use the chat panel, and we will go over all of the questions at the end, okay? So I do want to mention, for those of you with ArcGIS Online, you already have this capability. You can build out any of these sites and do the things that Alfredo and his team have done, or build out what was done for Maryland or Pinellas County or the other sites that I showed. And ArcGIS Hub sits on top of your ArcGIS Online. So again, you have this tool at your hands. And since it's already integrated into your ArcGIS Online, retrieving apps and maps and data is really easy to do. And for those of you on the call who are unaware of what ArcGIS Hub is, it's a cloud-based smart city engagement platform that enables information sharing, inclusive collaboration, and inspires people to be a part of the decision-making process within governments. And what I want to do really quickly is show you some resources for your COVID-19 response. So here we are on Esri's COVID-19 resources page. There are different data sets that you can use for your own analysis. There are different apps and maps that you can explore. And there's also some additional resources which will take you to a couple of the different COVID-19 solutions that Esri has been working so hard on, like the business recovery solution and the business continuity solution that you can see here. And within the site, you can learn more about what different governments are doing through blogs and see what tools are being used for these different models that I was talking about earlier, and so much more. So I encourage you to go to coronavirus-resources.esri.com to learn a little bit more about these resources. Next, I want to show you how easy it is to actually deploy one of those solutions or a hub site. So here I am at hub.arcgis.com, and I'm going to browse the hub templates. And there are 18 out-of-the-box templates ready for you to use. And what I've done is I'm giving it a name. And so what's happening is some assets are being created for me in the background here. And when I land on the site editor, don't worry, you don't have to know HTML or CSS. You don't have to be a web expert at all. It's totally editable with point and click capabilities. So I want to show you how easy it is to change the site. And by enabling our templates, the application widget is pre-populated. So I can add in applications, story maps, and dashboards. So for this, I'm going to add in a map widget, and I can select to load in an application from my content, my organization, or the world. So I'm choosing to go to the world, and I just clicked on the first map that was up there. And as you can see, it automatically shows up. Again, it's directly integrated into your ArcGIS Online, so bringing in your applications are so easy. So just to show you another example of how easy it is to customize your site, I'm selecting to bring in an application from my ArcGIS Online. And again, I'm opting to choose something from the world, and I could narrow my selection by what kind of application I want, whether it's an insight or an experience or a dashboard. So I'm choosing to put in a survey 123 because maybe I want my community members to give me feedback or provide better insight into what businesses are doing within the community. So I will not be going into all of these capabilities that Hub has to offer, but I encourage you to log into hub.arcgis.com and explore the tools that you have to create a great site. You can add in videos from YouTube, social media sites, and pictures and virtual events happening within your community. So here's how to get started. Let us know if you are interested in using ArcGIS Hub for your own work. We're happy to dive into a more detailed demonstration or support you with standing up a Hub site. And if you don't want the DIY approach, we also have a launch kit available to help you get started with your Hub site. And we've also been working alongside Esri partners that provide related community engagement services together with ArcGIS Hub. And by the way, we are here to help, and it would be great to spend time with you all and discuss your community's needs and efforts. But we do have limited time over the next couple of weeks. So please let us know what you are doing. We are happy to sit with you and discuss your projects and discuss your COVID-19 response. And like I said, you already have access to it. And I would really be so happy to go over some of your ideas. And you will be able to set up a time that works for your personal schedule if you select yes. So I'm happy to see that some people are answering this poll.
Great. Yeah, Morgan, we have many people who've submitted their answers, and I'll leave this open for just about a minute longer. And we have a lot of questions that have come in, so I want to leave time for those questions. So I'm going to close out this poll real quick and let Morgan finish up, and then we'll get to your questions.
Thank you so much, Maria. And yeah, you know, if you want to stay connected with us, this is our contact information. These are emails. You can also find us all on LinkedIn as well.
Yep, and we have a variety of resources up on the screen here that we'll leave on the screen while we're answering questions. There's also a handout that was included here in the GoToWebinar meeting, so you can look at your handout section and you can download that PDF if you need that. So some of these resources include that COVID-19 it's a hub site, but it's like a resources site that Morgan had showed earlier. We have an example gallery on hub.arcgis.com. There's a gallery of just a variety of different like government hubs, nonprofit hubs, but then there's also a tab that specifically gives you COVID sites that you can look at. You can subscribe to our newsletter by visiting go.esri.com/gethubnews. Get-hub-news, and you can follow us on Twitter at ArcGIS Hub. So let me get on with some of these questions. There's many for Alfredo. So Alfredo, one of the questions that was asked was, how many GIS professionals are on your team? And also, one of our attendees is wondering, does New Haven facilitate any virtual meetings or conferences for the public with Hub? Or any other third-party platforms?
Yeah, so to the first question, I am the only professional GIS person at the city. I would have a lot of what I would call power users embedded within departments. GIS is not their main role, but I've been working with them very closely to make sure that they are well versed and competent with the technology, so that they can kind of take some of that burden of the mapping off of me. Like I said before with the food policy director, they know the data and their source and their subject much better than I do, so they can do a better job with it than I can. So what I've been trying to do is enabling those people to kind of do it themselves, so to speak.
Great.
And then, yes, the web platform stuff, we primarily have been using Zoom for meetings, whether that's city council, planning commission, board of zoning appeals, and things like that. We provide the links through Zoom, and sometimes we do survey 123s to kind of solicit feedback before and after.
Okay, and now two other questions that have rolled in is what kind of training did you do to enable the other departments to create their own hub sites? And then what advice would you give someone who plans to implement GIS in a rural area? So we only have a few minutes left, so I'm trying to cram in as many questions as I can here.
Yeah. So the rural area is going to be very different than the way that I've deployed it, mainly because New Haven, even though we're not very big, we're very, very urban. Your focus is going to be a little bit different than ours. Ours is very much community services driven, whereas in a more rural setting, you may be more into kind of land cover analyses, like things like, like what kind of soil is important, how can we develop here, how can we do maintain environmental impacts over there, that kind of thing. So your system may not be quite as robust, but all of the same tools that we're using are still applicable. It's more of a matter of scale. And then as far as the training is concerned to the departments, depending on the user's technical expertise. So for example, the health and wellness and safety team, they were very non-technical, so I had to make sure that, okay, yes, here's all the widgets, here's how you put them in, just worry about the text, and then if there's anything else that you need to do, help finding pictures, integrating the pictures if you have trouble, that's kind of the way I support them. So that was probably my longest training. That was probably like closer to half an hour, 45 minutes. So then the City Plan Commission, they were already somewhat based in GIS. They knew how to make maps. I just showed them, it's like, okay, here is how the hub platform works. Here's how you add the widgets. And then more importantly, in certain key places, sometimes you do have to inject a little bit of HTML or CSS. Most of the time, it's very, very kind of non-threatening. It's very, very easy stuff. Oh, I just need to put a URL in this little section of code. So I would walk them how to do that and show them, like, here's what the code looks like. I know it's scary, but it's not really. And then you go to the food policy person that's already done a little bit of CSS or HTML and just said, okay, here's this, here's how you customize that, here's how you customize that. And even though we spend about an hour on the phone, we were getting into really, really deep technical stuff. So that's one of the nice things I like about Hub, is you can approach it from a really what you see is what you get kind of approach, or you can just completely write your own and really extend the platform to do some crazy stuff.
Awesome, that's great. And we are coming up on the end of the hour here. So I really want to thank you, Alfredo, for joining us today. Alfredo's a longtime Power ArcGIS user and a past winner of our Special Achievement in GIS Awards at UC. And so we're really, really happy that you were able to join us today. And it's an amazing story. And what I like about it is that it shows that this framework and the steps that you've used work not only for COVID, but really any situation that a community may face, natural disasters, responses to fires, or like you mentioned, redeveloping or attracting new businesses to an area, even initiatives like reducing homelessness or creating more housing in an area. So this has just been a really great webinar, and we thank you, Alfredo, and we thank you, Morgan, too, for all of your expertise in this area. And thanks to everyone for joining us today. We will please make sure you download that PDF. We will also be sending follow-up email with the recording of this webinar, along with links to other resources. And if any questions that we didn't get to, I will get to those offline, sending you personal email. And I think that wraps it up for today. We hope you'll join us for future ArcGIS Hub webinars, and that you'll try experimenting and launch a hub site as soon as you can, because if you have ArcGIS Online, you can make one today. Have a great day, everybody.
Thank you.
Thanks. Bye-bye.
Bye.